If you look across Europe, from our perspective, as our European region stretches from Vladivostok to Reykjavik, so you get a sense of the breadth we're talking here. So about half of our member states within the European region have experienced a 50% increase in cases in the last week, and if you actually put that to a 1/3 increase or more, that goes up to more like 2/3 countries. So clearly, across the board, we're seeing large increases in cases. What we are also beginning to see now is hospitalisation starting to track that, and even deaths beginning to track that. And certainly, going back even a couple of months, we would have maybe had 2,000 to 3,000 deaths per week. Even as much as 2 months ago, but now we're seeing a very large increase in the number of deaths per week, and it's now approaching something like 8,500 deaths per week across 48 countries. So you're definitely starting to see that tracking up of mortality. The question is, will it go back up to the very high levels we saw in March, April or not? And as Maria said, there's hope that that is not the case. Number one, the age profile of the positive cases at the moment is much younger. Certainly clinical care pathways have got better. And people may be getting lower doses of exposure, and we have to look at this, and we are looking at this at the moment, to see whether the measures may not be fully effective at stopping transmission, but maybe the physical distance, maybe the masks, maybe all of that is reducing the dose of exposure that individuals are being exposed to, or the time of exposure. And exposure time and exposure dose are related to your likelihood, number one, to be infected, but in many infectious diseases, very often related to the severity of infection that you actually experience. So we have a lot of factors to look at in terms of why, number one, is the disease increasing? Can we keep that death rate down to the lowest possible level? And it may be, and as Maria said, when you look inside those numbers and inside countries, very often there are areas within countries that are driving a good percentage of that transmission. So the question for each country and for the whole region is, how can we get those numbers back down to manageable levels again in order to be able to fully re-engage on case identification, contact tracing and full quarantine of contacts. But you know, let's be plain and honest here. If you are a case or you're someone who's positive, you should be at home in full isolation or in a clinical care facility. If you are a contact of a case, if you know yourself to be having been in contact with the case, you should be in full quarantine at home without contact with other people, or in a third facility and without contact with other people. And that is not so as to imprison people, that is so as to break chains of transmission. If we're seeing transmission now at community level, and then we do big major lockdowns and we push that transmission back into the household, and what we're seeing in many European countries and North America is that a good deal of transmission is occurring at the household level. So it's gatherings at home that are doing a good deal of the transmission. So even if you end up with a societal level lockdown and people continue to gather in those environments, we're still going to promote and continue transmission. So countries are facing many dilemmas right now. But for me, if I get a chance or a golden wish to improve one thing that we could really, really improve and change the game here, apart from all of the other advice about using masks and physical distance and asking that people can stay the course, and it's tough, but if I was being asked, as a public health physician, if I was asked for one thing that could improve, that might change the game here, that is making sure that each and every contact of a confirmed case is in quarantine for the appropriate period of time, so as to break chains of transmission. And I do not believe that has occurred systematically anywhere, and particularly in countries that are experiencing large increases now. That has been very hard to sustain over the summer, and I think a good part of the reason why we're seeing such high numbers at the moment.